Good afternoon, everyone, and welcome to our press conference today in regards to the results of the 2020 opiate numbers, as well as information regarding suicides. You will hear primarily from Dr. Gail Burstein today, though we are joined by Karen Gambino from Deaf Access Services to provide assistance for those in the hearing disabled community. We are also joined by Rylmoore, who basically is the program director of our Erie County Opiate Task Force. We have some numbers to share now that we're almost completely done with the 2020 analysis. And unfortunately, as I've mentioned recently, we have seen an uptick in the number of overdose deaths associated with opiates, which primarily now is fentanyl. You started out with the Opiate Task Force. Of course, we were dealing with a significant issue with heroin, but now it's primarily the drug fentanyl. But I'll just turn this right over, and then I'll turn it over right now to Dr. Burstein to talk about what unfortunately we saw in 2020, which was an increase in the number of opiate overdose deaths in Erie County and the specifics associated with that. So Dr. Burstein will talk, and unfortunately we had 3 great years, or better years of number, and now we went back up.
Whoa. Thank you, Mark. So I'm very sorry to say that we are seeing once again an increase in opioid-related deaths. And we really feel that this is, again, one of the losses that we suffered of the hard-fought gains that we had made prior to the pandemic. So the pandemic is not only affecting people's lives from COVID, it's also affecting people's lives from other health conditions like opioid use disorder and other substance abuse disorder. So here I'm going to talk about what we've seen in 2020, as a county executive mentioned, of our opioid-related overdose deaths, so which is a very sad story. So in 2020, so far, we have 232 confirmed opioid-related overdose deaths. There are 17 cases that are still pending. However, this is about almost 50% more in 2020 than the 156 opioid-related deaths that we saw in 2019, where we had our lowest number in several years. So we've really lost some ground here. We've had, as you remember, a pretty significant 3-year decline starting from 2016 when we initiated our opioid epidemic task force, and we've continued to decrease in our numbers due to our great programming with the community banding together through 2019. However, we've really lost a lot of ground in this year in 2020. So this is a graph looking at our opioid-related deaths in So this is a graph looking at our opioid-related deaths in 2012 through 2020. And so you can see that our peak occurred in 2016, where we had 301 opioid-related overdose deaths. Then we banded together. Our county executive helped us form this opioid epidemic task force, and we brought together many people from diverse backgrounds in the community and diverse expertise, and we really worked together to put together some great programming and great services for people struggling with this substance use disorder. And we were successful in bringing our numbers down. In 2017, we went down to 251 deaths, 2018 to 191 deaths, and then in 2019, we were down to 156 opioid-related deaths. Unfortunately, this year, again, in 2020, we've increased to 232 opioid-related deaths, and there are still 17 cases that are pending confirmation, so we still even may have a higher number in the next couple weeks. So another problem, as our county executive has alluded to, is that we're seeing a problem with people who are also co-using cocaine as their substance of choice, and not realizing that this has been actually tainted with fentanyl. We can hear from our Central Crime Services labs that really all the cocaine that they confiscate from crime scenes all is spiked with fentanyl. So there is really no cocaine in our community that is safe. It all has fentanyl. And this is a graph that really demonstrates this. So this is looking at all the percent of our Erie County opioid-related deaths that are associated with both opioids and cocaine in the tox screen. And so you can see it was pretty low, about 15% in 2016, and it's increased to almost 45% now in 2020. So we're seeing a lot of people die, unfortunately, home alone. We think that they think that they're just using cocaine as a party drug, that it's nothing dangerous. It's not a dangerous drug, and they have nothing to worry about. And then, unfortunately, they wind up dead because they don't realize that there is fentanyl. And instead of getting some type of surge, a high, a stimulant high, they're getting respiratory depression and then overdose and death. So this graph is looking at the suspected non-fatal overdoses in Erie County during the year 2019, which is in red, and 2020, which is in orange. So again, these are all the non-fatal overdoses that law enforcement has responded to. So if what is not included here are the overdoses that ambulance have responded to, or people that just showed up in the emergency department and were not involved with first responders. So you can see it is very obvious that the orange lines, which are the 2020 overdoses, are much higher than the red lines, which are the 2019 overdoses. So we not only have a problem with fatal opioid-related overdose deaths, we also have a problem with non-fatal opioid-related overdoses. And this graph is looking at locations of residences of our victims of our opioid-related deaths. So that story hasn't changed. We're still finding victims throughout Erie County. There is no place in Erie County that is immune. Anywhere you go, you are not safe. The drugs are deadly, just as deadly in the city as Buffalo, as they are in the northern suburbs, as they are in the southern south towns, as they are in the rural areas. So this is looking at a pie chart where the residents are of our overdose death victims. So you can see almost half are in the city of Buffalo, and there's a disparity there because only 28% of our Erie County populations lives in the city of Buffalo. However, a significant, almost as much are in the rural and suburban areas combined. So this is a problem everywhere. You're not safe because you live in the burbs or a rural area. And then we've seen also a slight change with our increases in opioid-related overdose deaths in 2020. So this is a chart looking at our 2020 opioid-related deaths on the right-hand column, and then comparing that to our 2018 opioid-related death demographics in the middle column, and then comparing that to our population percentages in the right-hand column. So if you look at the top level of this chart, here we're looking at race ethnicity, and you can see that in 2018 that the proportion of people who were opioid overdose death victims who were white is very similar to the proportion of people who are classified as white in our Erie County population by the census data. However, if you look to the right on 2020, that number's starting to creep down. Now we're starting to see a lower number. About 70% of our opioid overdose death victims are classified as white. And where that pivots is looking at the victims who are classified as Black or African American. So according to the census, 15% of our Erie County population is classified as Black or African American. In 2018, of our overdose death victims, 10% were Black or African American, so that is a smaller proportion that what is lives in Erie County. However, in 2020, that started to increase. So in 2020, that pretty much doubled. So almost 20% of our opioid overdose death victims were classified as Black and African American. So that just showed us that the demographic is changing. The population is changing a little bit that is using. So just in terms of Hispanic ethnicity, that hasn't changed. You know, gender is still predominantly male overdose death victims, over 70%. However, we're starting to see some changes with age in our opioid overdose death victims. So remember, people in the 20 to 30s age group constituted only about 25% of our population, but in 2018, they constituted over almost 60% of our overdose death victims. So, so that is changing. So you can see in 2020, our overdose death victims instead of 29% of our population were between the ages of 20 and 29, there was a 50% decrease. So only 19% of our Erie County overdose death victims were between the ages, this young age of 20 to 29. Instead, we're seeing a slightly older age group that is falling victim to these overdoses. As you can see that in about 11% of our Erie County population are in their 40s. And in 2018, there were only about 14% of our overdose death victims that were in their 40s, and then that increased, again by about a third to 22% in 2020. So we are seeing a more diverse group of individuals, unfortunately, that are suffering from our overdose death victims. They're more people of color and more of a middle-aged population, and we also think that has something to do with the co-use of cocaine, that we believe that there are more, middle-aged people at home. They're alone, either because they're unemployed or because they're working at home, they're bored. They may be using cocaine as like a stimulant, like something to do, something to kill time, something to help them feel good, self-medicate, and then they're unaware that there is cocaine on board, that there's fentanyl on board, and they may overdose. I have to say there is one piece of good news with our suspicious causes of death, and that is with our confirmed suicides. So in many parts of the country, because of all the depression and loneliness and isolation, they're seeing an increased number of suicide-related deaths throughout the United States. However, in Erie County, because of the hard work of our crisis services and our Suicide Prevention Task Force, actually in 2020, instead of seeing an increase in completed suicides, we've seen a decrease in completed suicides. So in 2018 and 2019, we had a little bit more than 100 completed suicides, and in 2020, we had about a 10% decrease, 92 completed suicide deaths. So that is really, despite the pandemic and all the loneliness and despair of associated with the pandemic, through the good work of the people working at suicide prevention in Erie County, we are still able to bring those numbers down, and we are still working on bringing those numbers down either farther. These are all preventable deaths, and we're working very hard to prevent our suicide deaths as well as our opioid-related overdose deaths. So now I'm going to talk about some new cool tools that we have. So obviously during the pandemic, we couldn't be doing what we had been doing before because we weren't able to be in close contact with individuals. We couldn't have large trainings or Narcan. We couldn't have the same face-to-face interaction, which is so important with the community. So we have new strategies that we believe are going to work. So first of all, a new tool that we have is, of course, online. So everybody can use it, risk-free. It's called Naloxone Track. And this is a tool where people can find out where naloxone is nearest them. So on the left-hand side is a map that maps out where all the emergency Narcan boxes are distributed in Western New York. And so I just happen to have one here just to remind people that this is what they look like. They should be in, this is what they look like. They should be in public spaces. You should see them hopefully in businesses, in restaurants, in bars, in government buildings. Wherever you go, hopefully you can see them. And this is so if somebody has an instance where they're overdosing, you can just easily open up the lid, take out the Narcan, and anybody can use it. So this is a new tool, and on this map shows exactly where all these boxes are located. If you have a site that you think needs one of these emergency boxes, we are still dispensing them free of charge to everybody in Western New York that really feels that they can use them. So what you can do is contact the health department, and the information is on our website, and we will make sure that you have an Narcan emergency box. Also, on the right-hand side is a map showing where we have the highest use of our Text for Narcan distribution program. So this is looking at zip code, where the darker colors is where we've been able to distribute higher numbers of Narcan. So again, we know that people aren't coming to our classes in person to get Narcan, and it's more difficult to come directly to the health department to get Narcan. So what we want to do is make it easy for people to get it, because this is a lifesaver. So we have a program called Text for Narcan that I'll talk about just now, and you text the number, and the only information we need is where we can send the Narcan. We also have a great program that really started in Erie County from our emergency medicine docs in Buffalo, especially Dr. Joshua Lynch. It's called New York Matters, because it started in Buffalo. However, it's been such a successful program. It's got so many people into treatment, saved so many lives, that it's really been extended throughout New York State. So Matters is smartly, it's people who are struggling with substance use disorder matter. However, Matters also is an acronym for Medication-Assisted Treatment and Emergency Services. So this is actually available virtually. You do not have to go inside an emergency department. Also, police departments are starting to use this too, working with peers. So this is being more widely available. So if you feel that you're struggling with an opioid use disorder and you want to start buprenorphine and you don't want to go anywhere in person, which is completely understandable, and you aren't hooked up with a long-term provider yet, you can just go to any of the emergency departments websites in our area and click for a virtual appointment at the websites at the emergency departments, and click on that you want a Buffalo Matters appointment at these emergency department websites, and you will be able to start that day your long-term medication-assisted treatment, and you'll not only get a prescription for buprenorphine to last you a couple weeks till you can make your appointment either in person or virtually. You'll also get your first appointment and being able to get linked up to a peer, and then also a mechanism to get some Narcan to your home. And so this is just highlighting some of the great services that we have, that we've been able to pivot and make changes so that we can get these out to people during our COVID-19 pandemic. So we're still doing a lot of social media and regular traditional in-print media. Remember, warning people that cocaine and also meth are not safe in our community. Everything is spiked with fentanyl, and there's a good chance you will overdose eventually. It's Russian roulette one time again. Also, again, we have our emergency kits, which you can get to a site, any building that you might work at or have to frequent for some reason. We want to get these out as much as possible. There's also on the upper right-hand side is a picture of the Narcan sprays. It's just a nose spray. It's really, anybody can give it. It's really easy to use. And then again, we have our text for Narcan. So you can go onto our website. You can sign up for a training. And you can also, there is information about the availability of getting Narcan to your homes. So we also have our Erie County Addiction Hotline at 716-831-7007. And there, people will be able to get good information about opioid use disorder and all substance use disorders. And then also, if you're an individual that wants an appointment, you can get your first appointment by calling this number. So I am going to turn it over to our county executive that is going to highlight some of the great media, highlighting the great programs that we have in Erie County. Do you want me to help you with that?
Thank you, Dr. B. Text for Narcan, 225-5473. You can text it. It is confidential, and Narcan will be delivered to you. We want people to understand that we would rather deliver free Narcan to you than have another part of our Department of Health deal with you, which is our medical examiner's office. It's as simple as that, because our medical examiner's office is the one that generally gets those cases when someone overdoses and dies. So 225-5473. Dr. Burstein highlighted the addiction hotline. It's still going. It still receives calls. And I want people to understand we're here. It's a 24-hour hotline, 831-7007. Here's Antonio from our task force, who actually works for the Department of Health. He is a perfect example of what you can do, because he had the problem associated with addiction, and now he helps people get through addiction. 831-7007, the 24-hour hotline. Please call. These are trained professionals who will get you the services that you need. Once again, we'd rather you call the hotline than deal with the medical examiner's office. People thought it was funny when earlier in this year I said, don't do cocaine. It became a meme. My face showed up on a shirt. It was serious because, as was noted from the statistics in 2020, there were a lot of people who died of an overdose of fentanyl, an opiate, who really thought they were just snorting cocaine because they've always used cocaine. It's a party drug. It's fun. Or they use it, as the doctor noted, by themselves at home, thinking, I've done it, no problem, and they die. Because, unfortunately, the cocaine supply, as the doctor noted, almost has fentanyl to some degree in it now. It may give a bigger high, but the high may be so good that you die. So don't trust your cocaine. You should never use it alone if you use it. And you should always have Narcan available, because almost all the cocaine is spiked now. So yeah, my face showed up on a shirt. People thought it was funny, but it's not funny if you're a loved one of someone who died because of an overdose associated with opiate, fentanyl, when they thought they were just using cocaine. And oh, by the way, cocaine can kill you too. It's as simple as that. It's a drug. It's not a fun party drug. It's a drug that can kill you regardless of whether there's fentanyl in it or not. But for many individuals, if there is fentanyl in it, it's a death sentence. And I want to thank, what's over there? I want to thank our opiate task force for all the good work that they've done for the last few years. We did see a reduction in the number of deaths, and it's only because of the tremendous work of our task force. So I want to thank Cheryl Moore and her team. Cheryl, I don't know if you want to come up and say a few more words. You've been instrumental in this, so would you like to, if there's anything else that we missed that you'd like to add, please come up so that the public understands that we're here to serve. And I want to thank Cheryl, too, because she's worked very hard over the last year to respond as well for the pandemic, as well as addressing the issues of the opiate epidemic, because just because the pandemic took effect doesn't mean we stop and eliminate everything else we were doing beforehand. There's a lot of stuff we were doing beforehand that still continued even through the pandemic. So Cheryl, why don't you say a few words?
Thank you. Thank you, County Executive. I really appreciate it. My name's Cheryl Moore. I'm the director of the task force, and I have the wonderful opportunity to help people with this. The numbers have gone up exponentially over the past year. It's breaking our hearts. Everybody really needs to take this message seriously. Make sure you have Narcan available. No drug is safe out there. Any help that you ever need, you can call us at any time. Our main number at the health department is 858-7690. You will get to me. We have an event. We have a recognition event coming up. It is on March 6th. It is the annual Black Balloon Day. It will be virtual this year. It'll be at many sites in the community. It'll be up on the website. Sparks of Hope will have a site. We'll have a site here. Obvious Zeros Group, Save the Michaels is participating. Many of the groups. They will have balloons that will be at the site. You can bring them home to your home, hang them off your house, recognize and remember people that we've lost. No one woke up one day and said, I want to be a drug addict, and just keep that in mind. Thank you very much.
Thank you, Cheryl. Might as well hang up here with the doctor in case we have any direct questions. We'll open it up to questions now. So we will start with WKBW Channel 7. I think Jeff Slauson's on.
Yep, yeah. Hey, Mark.
Hi.
Now that these programs are pretty well established in figuring out how to handle the pandemic, is there an expectation that if the numbers do spike, that the numbers in opioid-related deaths would not spike with it?
I think I know your question. I'm going to turn it over to the doctor. But when it comes down to it, the programs have been in place for quite some time, and our concern during the pandemic was we were not able to get directly in touch with individuals that we did beforehand. The one-on-one personal contact, because you couldn't really have that one-on-one personal contact. People were using drugs alone by themselves in their home, where they may have actually gone out and used it with other people previously. So our goal is to continue to reduce all overdoses, so there are no deaths and there are no overdoses. We know that's probably not going to happen, but our goal is to do our best to eliminate all overdoses and deaths using the resources we have. We have lots of resources. The number one resource is our team, but if somebody's at home, they can call the hotline, 831-7007, any time of the day, 2:30 in the morning, you can call. The phone call will be answered by a trained professional here in Erie County. You're not going to talk to somebody in Kuala Lumpur. You're going to talk to someone who's trained in Erie County. And we want people to take advantage of the resources that exist, because if they have a problem, we're here to help. It's as simple as that. And we will get to you, even if we can't get to you immediately on the one-on-one contact, we'll get to you somehow. Dr. Burstein or Cheryl, do you want to add anything?
So as a county, whoops, move this. As a county executive put it so eloquently, one of our challenges during the pandemic is that it was more difficult to reach people one-on-one. We have an army of peers that we had been infiltrating the community to reach out to people. The people were self-identifying as using opioids, and it was pretty easy to reach them and work with them, and eventually bring them along until they were ready to get treatment. And now it's more difficult to find these individuals. Also, as I mentioned, the demographics are changing. We're seeing a little bit of a different population that is, they don't acknowledge that they have an opioid use disorder because they're using cocaine and they're just using it for fun, and it's not a serious drug, and it's not anything to worry about. However, we know that's not true because almost half of our opioid-related overdose deaths have cocaine in them as well as fentanyl. So what we're doing to try to address this is to really reach out and invite people in, but virtually, because that's where people are most comfortable. So we have our hotline, we have Buffalo Matters that you can go and book an appointment online. So you can get Narcan by texting. You can get virtual training for Narcan, how to recognize an overdose. So we really want people to get our services. And if you're somebody at home alone struggling with any type of substance use disorder, we really care about you. You don't have to struggle alone. Please call our hotline. Please reach out to Buffalo Matters and start to get treatment. You'll feel so much better, but you are not alone. We're not physically there, we are virtually there, and we are there, we are present. Thanks.
If I could add, there's one thing that Cheryl mentioned to me about a month ago that really resonated, is cocaine is often looked at as a recreational drug. Well, it can kill people, as we talked about. But one of the things that you need to think about is when cocaine is being spiked with fentanyl, fentanyl is highly addictive in addition to being a non-recreational drug. And so individuals who use cocaine are using it more often because they become addicted to the fentanyl in the cocaine. So they don't realize they are now addicted to the substance that is in the cocaine, the fentanyl, and so they're using it more often, and there's a higher risk, of course, for overdoses and deaths. So we want people to understand that not only is cocaine dangerous in its pure form, with the spike of fentanyl, not only is it dangerous for death, it's become highly addictive to the individuals who may never have been and don't consider themselves an opiate user. But they are an opiate user now, and their brain has been wired for the opiates because the cocaine they've been using is spiked with so much fentanyl they've become addicted to it. Did I say that right?
That's absolutely correct. Thank you so much.
I got the thumbs up. Channel 2, WGRZ, are you on? Any questions? Channel 4, WIVB, anyone on? If not, Spectrum News, Andy Young.
Hey, Mark. What is the outlook, and maybe the doc can answer this as well, what's the outlook for ramping up the in-person services that had been so critical in helping battle this epidemic amid the pandemic now?
I'll turn that over to the Dr. Burstein and Ms. Moore.
So the question is, when can we ramp up in-person services? So we are doing in-person, and they're virtual in-person. So we still have to be respectful COVID-19. COVID-19 kills also in addition to opioids, so we don't want to put people at risk of COVID-19. So we still have to practice our social distancing, and many healthcare services are actually being offered virtually. Many primary care visits, sick visits. So this is really the new norm of healthcare, and we think that some of this will continue to stick even after the pandemic is over. So we don't have any direct plans of offering in-person, face-to-face services. We're still offering face-to-face virtual services, which I think are still very effective. We know we're still getting a lot of people trained, we're getting a lot of people into treatment, and people are receiving the care that they need. We just have to change our mindset a little bit. Just because we can't get somewhere physically doesn't mean that we can't get the services. They are available virtually. Thanks.
Mike Baggerman, WBN, I believe you're on.
Hey, Mark. Hey, Gail. I'd love to get your guys' thoughts on how this is impacting young people. When I was looking at some of your data today, 47% of people under 40 had died from an overdose. That is more than 100 people based on the numbers that you have. And I look at it in comparison to coronavirus, for example, where 18 people who are under the age of 40 have died over the last year because of COVID. I would just love to get your thoughts on the impact that the opioid epidemic is having on young people in particular.
Well, I'll just note before turning it over, I mean, the opiate epidemic has had a tremendous impact on younger people for quite some time now. One of the things that we've noticed this past year was the number of individuals who died who were older. And those we believe primarily were either habitual, long-term opiate users, or those who use cocaine didn't realizing that they had fentanyl in it. But the opiate epidemic has been terrible when it comes to the younger generation. So I'll turn it over to the other two to speak about it, but it's been something we've been dealing with for a number of years now, watching individuals in the prime of their lives, including even teenagers, die from overdoses, but especially 20, 30, and 40-year-olds. It's been a problem for years now.
Well, the county executive was spot on with his response. I mean, we are still seeing many young people who are affected. However, we're seeing a slightly higher proportion now, and growing cohort of people that are middle age, and those could be people that have been using for a long time, and something happened and it tipped them over, or it could be people that have been using cocaine or other substances of use for a long time, and now they're spiked with fentanyl, and they're alone when they're using. So this is really the story is that is affecting people at all ages. Now, earlier in our pandemic, we were especially concerned and very focused on our younger population. We're still very concerned and focused on our younger population. We're still seeing so many people that are falling victim of opioids, not just fatal overdoses, but they're home alone too. They're online. They're bored. They are like ordering funky things on the internet that is being delivered to them that are drugs from out of the country or other parts of the country. I mean, you hear it on the news that families are losing their loved ones, their young ones, because they wanted to experiment at home alone. They're getting stuff in the mail. I mean, we're all getting stuff in the mail, so it's hard to tell. However, we're also seeing an older population too. So the story is not that young people are less at risk. The story is now that all ages are at risk. Even our seniors are at risk. So there is, nobody is immune by age. Nobody's immune by where they live. Even though we're seeing more males than females, we're still seeing females affected. So, and we're seeing, people of all race, ethnicities affected. So everybody affected. That is the message. Thanks.
Is there any other news outlet on the call? If not, we'll open it up for one more set of questions from each. Jeff, do you have any questions? Any additional ones?
No, I'm all set, thanks.
Okay, Andy, any more questions?
Going back to the decrease in suicides, what do you attribute to that? Obviously, you mentioned crisis services and some of the abilities they had to reach people, but that almost seems counterintuitive, but it's a good thing.
It is a very good thing, and I think a lot of it has to do not only with the resources we have here with crisis services, crisis intervention teams that now exist with police departments, working with mental health providers so that an individual who was suicidal in the past is getting the immediate services that they need. We understand that there are a lot of people under stress the last year, as there are always people under distress, but I think it goes to show that the partnerships that we've put in place with many partners in the mental health community, as well as the police department community, have made an impact. You have heard the stories about suicides increasing across the country in 2020, and we did not see that, and we were monitoring it all year. We were hearing people saying, "Oh, you're not talking about the suicides," and we were looking at the numbers and we're saying, "Well, we're not seeing that growth here that you saw elsewhere," and we believe it's because of the strong partnerships we've put in place with other mental health professionals as well as law enforcement to ensure that people get the services they need when they need them. We want people to understand, even in their darkest days, they are not alone. Help is available through our crisis intervention programs that exist. And we want people to contact those programs so that they understand that if you feel it's your darkest day, it's never going to get any better. Hope is definitely there. There are brighter days ahead. Just call us, let us know the issues you're dealing with, and we'll be there to help you. Anything you'd like to add? No, I think I got the thumbs up on that one too. Final question, Mike Baggerman, any more questions?
I'm all set, Mark. Thanks.
Okay. Thank you to all for participating, as well as those at home who are watching. This is very important information. We were disappointed to see the overdose death numbers go up last year. It's something we hoped didn't happen, but did. We have a trained group of individuals who are there to assist people, as I noted, 24 hours a day, 7 days a week through our hotline, and our Department of Health here is here to assist you as well. If you have a problem with addiction, if you are fearful that, okay, I don't think I don't have an addiction problem, but I use cocaine and I've been using a lot more of it lately because my body's telling me I got to take more of it. You probably are now addicted to it because of the fentanyl inside. Please call 831-7007. Remember James Bond, 007. 831-7007. We are here to help. Our team is here to help, not only with the county, but with our partners in crisis services, as well as our other partners to fight this scourge of opiate epidemic. We are dealing with an epidemic and a pandemic. The epidemic hasn't ended. It's been out there for a number of years. It was getting better, but it's still here. And we still have a pandemic. So please wear your masks. I got 2 of them on. Make sure you wear your masks when you're out in public and you can't safely socially distance. And if you need help because of an issue associated with an addiction matter, call us, 831-7007. We're here to help. Thank you all. Thank you, Karen, once again for your good work in providing American Sign Language, and most importantly to all, be safe and well.